I am Dr. Eric Hicks. I'm the Occupational Therapy Program Director for the Occupational Therapy Programs on the Austin campus. And so this is part of your student readiness orientation, and it's more of just answering any questions that you have. There is no formal presentation that I have tonight, and we will be sending out additional information for you or to you related to getting prepared for the beginning of the term, which is going to be January 12th, Monday, January 12th. So we still have a couple weeks until then, but I'm here to kind of just answer some questions any questions that you might have. So if you have any questions, feel free to raise your hand and I will address those or put any questions in the chat. And I'm just going to admit people. So what questions do you guys have about the residential program, that is?
I guess like one
Mhm.
of the questions I have is so that tentative schedule on our US portal, is that kind of like what our schedule is going to look like for the most part? I know that's not really specific to like the actual residential program, but I just kind of want to know if like that's going to be our like specific schedule in general.
Oh, no, that is a great question. That's very relevant for the residential program because that's what you guys will be expected to do. So, right, so you have to be able to schedule out your time and your day in accordance with kind of what the expectations of your class
Class
when your
when your
classes are
classes are
meeting.
meeting.
So
So
yes,
yes,
that is pretty much the schedule that you will be following. You do want to go back and make sure that you have the most updated version as it gets closer to that Monday, January 12th deadline, because sometimes we do have changes in instructors, um, or sometimes we may have to change some courses around to fit other courses and other terms around. So because of the instructors who are teaching different courses. So sometimes we do have to move some things. So I would say make sure that you go in as it gets closer to that Monday, January 12th date and pull the actual schedule. The other thing, as you're looking towards planning any vacations or holidays or anything like that, I would say when you also, another piece of advice that we've learned through through the past couple years or so, that make sure as you're looking at holidays and when you can plan vacations or plan to go to see your families or whatnot, to make sure that you go to the portal and look at the university calendar that's paired with the catalog, and look at that and for dates instead of anything that may be printed, because that calendar online is consistently updated. And so sometimes those dates change. So you want to make sure that you're looking at the most current version. So look at the calendar that's on the portal and not something that's PDF'd or that has been shared and printed out, because those dates do change. And we have had that happen to students that they were expecting certain dates to be holidays or ends of terms, and they weren't because they had been updated from the schedule that they had. So, great question about scheduling. What other questions do you have?
I have kind of a dumb question, but the book list, um,
or not the book list, the equipment list for fall 2025, is that going to be the same for the 2026 start as well?
Oh, no, that's another great question. It will be similar to that. It will be similar to the fall 2025 list. However, if there are book edition changes, things like that, you will want to use the spring 2026 um, version of the equipment list. One thing, as far as books are concerned, you may want to hold out on books that have later or longer publication dates. So if there's a book that was published in 2018 or 2019, you may hold off on buying that book until you get confirmation uh, with your spring 2026 list to make sure that that's the book you need to buy. Because once a book gets about 5 to 7 years old, there's a new edition that comes out. So you don't want to get a old edition when in the spring we're ready to use the new edition. But any books that are published in like 2023, 2024, 2025, those should be good, safe bets that those are the ones that we're going to use. So make sure that you're using the most current book list, but also one that is related to the new curriculum. If there's any, make sure that you're sometimes even with our calendars, right? We did talk a little bit about calendars on the portal. Make sure when you're looking at schedules that you're looking at new curriculum schedules instead of old curriculum schedules, because we're still teaching out our old curriculum while bringing you guys into the new curriculum. So I don't think we differentiate our book lists. We haven't yet, but just make sure of that. But yeah, anything that's most recent as far as textbooks, you can be safe to say that you can purchase those.
Okay, sweet. Thank you.
Yeah, no problem. Any other questions? Any questions about what courses look like, what you should do to get ready, what it's like to be a graduate student? I will say one thing. I know that a lot of times during our physical orientation on campuses, we're like, oh, well, welcome to the OT program. You're welcome to being a graduate student, right? Congratulations, you're a graduate student now. And sometimes we think, oh, well, there's this obvious transition from you being an undergraduate to being a graduate student, and you guys know that difference. And so there are some expectations, and we're going to try to do better at clarifying what those expectations are of a graduate student versus an undergraduate student. But just know that when you move into a graduate program, especially our program, it's not as much of us as faculty members and teachers coming in, teaching you a lecture, standing at the front of the classroom, lecturing through materials and saying, okay, now go home and learn it. That's not what graduate school is like. The expectation for a graduate student is that students are taking their own initiative, that they're looking in their course shells, that they're reading their materials, they're reading through their Blackboard content prior to coming to class or lab or our synchronous sessions, and then collaborating with the instructor and learning the things that you need to know to be an occupational therapist. And so it's sometimes we don't know what you know or what you don't know. And so having those conversations and that collaboration is really helpful for us because we don't know where you guys are necessarily at with the material. And so it is helpful for you guys as students to let us know, well, we didn't really understand this, or we need to know more about this, or this is how we learn best, because we can make adaptations and changes to help you guys to be successful. But if we don't know, then we can't make those changes. So I will say that's something that I've learned from from one of our residential class that started this first term in this fall semester. That is one thing that we did learn, that they needed to we needed to do a little bit more training on what a graduate student is and what are the expectations of a graduate student, but also how learning is a little bit different. So
Kind of along that same line, what would you
yeah.
say is the like hardest transition from undergraduate to graduate student?
That's a good question. I think taking that part of that answer is being a self-initiated learner and being an active learner. You can't just read through your textbook real quick and gain everything that you need to know. You need to give yourself some time and space to process, but there is a lot of stuff to remember and a lot of stuff to review. So it feels like you're kind of getting buried, but you need to read more with the purpose than just read the text that's on the page or read the text that's in the blackboard, right? So that's one of those things. The other thing is, I think going to OT school is, even though it's a graduate program, is a little bit different, even on an undergraduate level, just because when you go to OT school, you're having to review anatomy that you've learned in Anatomy 1 and 2 that you may have not taken recently, as well as you're learning the language of an occupational therapist. So it's kind of the language of occupational therapy. It's kind of like walking into Spanish 3 class and expecting to speak Spanish fluently. And so some students get frustrated because they're not picking that up quick enough. And just know that that's normal, that you do need to learn the language. It is going to be a steep learning curve initially because you have to learn the language that occupational therapists speak, right? And so that's what you're doing the first term. So it seems like you have a lot more than you can handle, but it's just because you are learning a new language. You're learning new philosophy. You're learning new theories to guide your thinking and your reasoning. Whereas before you didn't have those things to guide your reasoning and why you would make one decision over another. So I think that's typically the hardest transition because you're learning that language, as well as learning how people function, how bodies function. You're learning different theories and different ways of thinking. You're also learning how to do evaluations at the same time. So you're learning lots of different foundational skills, but don't get frustrated because you don't see the whole picture yet. That does come with time. It's almost like you have to trust the process, and just try the best you can to learn as much of the language as possible your first term, because that will aid you in and set you up for success for your terms 2 and 3.
Yeah, that makes sense. It's like you kind of remember the anatomy, but then it's like having to relearn it all over again with different guidelines. So that makes sense.
Yes. Yeah, because we see it as occupational therapists, we don't just see it as, oh, here's the human body and here's these structures and here's how they work. It's how do all these structures allow someone or help someone do the things that they need to do in their everyday life, from cooking a meal to bathing to dressing, right? To gardening, to driving a car. Like, how are all of those pieces coordinated? And so we do a quick review, uh, like our human functions course. It's a quick review of anatomy. It's 4 weeks, but and so if it's been a while since you've had anatomy, we do have a refresher course that if you haven't already, you will be getting an email to do some refresh. It's like a refresher anatomy course that you can kind of just go through. It's a self-paced thing. I would advise you to use that, because you really do come in to class and you do hit the ground running, because we cover those basic things so we can get to the bigger things of like, why is this important in human movement and how people move and work and play and live their lives, right? So so you just got to trust the process and just learn as much as you can. But the nice thing is we do reiterate, some students, and I found this from this first term, some students feel like, oh, I have to learn every single thing right now in this time, and they get frustrated because maybe they don't feel like they're learning everything. And that's okay. We expect that. And because we expected that and anticipated that, we built the course, we built the program or the curriculum so that we reinforce those concepts over and over and over again in other classes. So there's a lot of crosstalk between classes within a semester, as well as a lot of crosstalk between classes between semesters. And so you may learn anatomy and human function, learn the basic ways humans move, but then in terms 2 and 3, when you take the interventions courses, you learn how people with mental health problems move and learn and think, right? You learn how pediatric clients in different settings move, learn, and think, and so on and so forth. So you get to apply those things. So it's not a one and done, oh, if I don't get it here, I'm not going to ever learn it, and then I'm going to not be successful on my field works. I'm not going to be successful on my MBCOT exam, and that's kind of a worry and a stressor that we found that students have, but it's not the case because of how we intentionally developed the curriculum to reinforce instead of everything being in isolation and silos. So hopefully that made sense. Any other questions?
So would you recommend like us to start reviewing now and just kind of do like an overall review, or just kind of go off of what they sent us in that email?
That's a great question. I would definitely use the email to the anatomy course slides as a good starting place. But if you feel like you have any gaps, and this is one of those skills as a graduate student, right? To be
Yeah.
self-reflective, right? So it's being honest with yourself and saying, maybe I don't know much about the integumentary system as I should, right? Or maybe I don't know as much about the nervous system as I should. So maybe I should dive a little bit deeper in there, whereas your anatomy class, some anatomy teachers focus on certain things and certain structures. So you may be well versed in those structures, but they may have said, oh, well, I want you to know the cardiovascular system. I want you to know the skeletal system and the muscular system. And they didn't put as much emphasis on the other systems. So yeah, you may want to go back and review those things. But yeah, being self-reflective on where you're at, what you know, what you don't know, is very important to be. It's an important part of being a graduate student.
Got it.
Yeah. So.
Thank you.
Sure. What other questions do you have? Any questions about fieldwork, requirements? Because we do begin fieldwork earlier in the term, and you'll start getting some messages about fieldwork. And with field work, you need to make sure that you read all of those emails. That's another thing about being a graduate student, is a lot of times you won't get your hand held to do things. When you get an email, you need to make sure that you're reading the whole email and make sure you understand the deadlines and the due dates for certain things, because you will get holds on your account, and those holds will keep you from being registered for the next semester until you take care of those holds. So I would advise you as graduate students now to make sure that you do read all of your emails, that you write down those dates, and that you review those dates and make sure you're going to be able to meet those dates. So one of those things in particular that I will say that we found to be a stressful part is, and I think you guys might have access already, but for our clinical education, all students begin their fieldwork 1 courses, which means you're doing observation experiences in different settings, different populations. And so in order to begin your level 1 fieldworks, you have certain clinical education requirements that you have to have completed before term 2. But you will get an email about 60 days before term 2 starts, and they'll say, if you haven't met all of those requirements, you'll start getting emails saying, well, you have a hold on your account because you haven't done X, Y, and Z. And so students freak out saying, oh, well, I haven't done it, so now I have a hold on my account. That doesn't mean you have a hold on your account for the current term. It does mean that you have that you will have a hold on being registered for the second term until you resolve those items. You do have so many days to resolve those, like 60 days. You have to resolve them before the end of drop add of the next semester, which is the Friday of that first week of class, but they do need to be resolved. And so that does stress students out a little bit when they're doing all of this new learning about occupational therapy and anatomy and human function and all that. And then adding to that the stressor of, oh, now I have to make sure that I have medical insurance, and I have to make sure that I have all my immunizations, which require titers, and then I have to get the immunization, then I have to take another titer. So it's a process that that you have to go through in order to get those things done. You also have to get your CPR training. And so there's lots of clinical education things that you will need to do. So I know that my students in my first term did say it would be very helpful if they knew that prior to moving to the toward, closer to the campus and all that if they knew beforehand what they needed to do, they could have taken care of those things before even moving while their insurance was active and, things like that. So that information should be, if it hasn't already been sent to you, it will be sent to you. So make sure you read that information. You can also find that information in the clinical education or fieldwork handbook. Okay, and it tells you what you need to have and what you have to submit to core. So I don't want you guys to be surprised about those expectations. Any questions about any of that?
All of that isn't due until the second term, correct? I'm on top of it.
Correct.
I know you just told me to be on top of it. I'm on top of it, but I
Yes.
just want to confirm. I just want to confirm.
Yes, you have, and really you do have the first, you have to take care of it before, by the first week of the next term. So
Got it.
yeah, by the second term. So because that's when add drop is. If you don't have it done, then they will drop you from your classes. So actually they won't drop you from the classes. They won't add you to the classes. You'll miss a whole week of class. You could potentially miss a whole week of class before, if you don't have your stuff done, right? Because they won't register you and you won't be admitted into your classes until you take care of those holds and the registrar puts you in the class. So you really don't want to wait till that first week, but you do have up till that first week. So
And that's something that like our advisor would email us.
You should get an email from the clinical education department, but you should be able to find the fieldwork handbook on the portal as well.
Okay, thank you.
Yeah. So, but your advisor will also help walk you through it, but you won't be assigned your advisor until you come to your first day of your in-person orientation, which is that Friday before classes start. So if you want to start sooner, you can ask the student success advisors or your enrollment advisors where to locate that, or if they, or when you should expect to receive that email.
And is there a dress code for that, for the orientation? My roommates are physical therapy students, and I know that they had a dress code, so I wanted to know if we had a dress code as well.
That's a good question. What campus are you going to be at?
The Austin location.
Oh, you are going to be on Austin. Okay, good.
Yes.
I thought I had a mixture. Are all of you Austin? I don't know. I guess I should have asked that question. I should
I'm
have had you guys
Austin.
introduce yourself. Okay, so you're Austin. I thought I had a mixture of different campuses. So, okay, that's a good question. Just professional, casual professional. It
Okay.
doesn't have to be, yeah, you don't have to be in a, fancy outfit or anything, but yeah, just be professional and casual. You know, most people do wear slacks or khakis and, a professional shirt, things like that. But, and that's usually, it depends on what campus you're at, but, it, some campuses do have specific requirements. Like for instance, Dallas, because of the building they're in, and they rent the space that other businesses are also in that space, they're required to wear scrubs. For Austin students in general, you can wear scrubs or you can wear professional casual clothes, and then for lab attire depends on what lab you're doing, but sometimes that's short, sometimes that's more clothes that allow you to move, like sometimes yoga pants, things like that. But your instructors will let you know what the dress requirements are for their particular classes at any given time.
Okay.
So,
And then I think my last question is on the equipment list
yes.
for 2025. Is that the same as, most likely going to be the same for the equipment list of 2026?
Most likely, yes. Usually we only make small changes to those lists.
Okay.
But you have, and I'm guessing the equipment list hasn't been posted then
Not from the last
for
time.
2026.
For 2026, no, sir.
Oh, okay. Hold on. Let me check. So, yeah, I'm kind of doing this a little bit backwards, but I would like to know a little bit about each of you. So I'm actually gonna ask you guys to introduce all those who are on the call. If you can introduce yourself and then tell me what campus you're in and what brought you to the field of occupational therapy. Just so I can know how to reference you guys. I guess I should have asked that sooner, but so I do have, I guess I'm going to start in a row just so I can keep track of who's here. So the first one I have is Ashlyn Span. Can you come off mute and introduce yourself and tell me what campus you're in?
Hi, my name is Ashlyn Span, and I'm at the Austin campus starting in the spring. And I think I chose occupational therapy from seeing it from like a family perspective and how much it can do for an individual in like all aspects of life. And yeah,
Okay, excellent. Well, good. Nice to meet you.
you too.
Thanks. And then the next one I have is Abby Purdy.
Hi, so I am also going to the Austin campus. Kind of got interested in occupational therapy for similar reasons. Just seeing different family members go through occupational therapy and benefit from it. So that's really what got me interested.
Oh, good. Okay, excellent. Thank you for sharing. And then Sophia Stewart.
I'll turn my camera off so you can see my face too. But I'm Sophia Stewart. I am also in Austin, and I start in the spring as well. And then I did occupational therapy as a child. So that was kind of my very brief introduction of occupational therapy, but was going through a little bit of a career change, and someone was like, you should look into occupational therapy. I think you'd love it. And then my mom knows an occupational therapist, so I sat down and talked with her and was kind of like, so what do you do on a day-to-day basis? What did you like about school? What did you not like about school? So she kind of talked me through that, and I was like, you know what? I think I'm interested in that. And got to work in a school setting for it, and I was like, I think this could be something I would be passionate about. So, yeah, that's a little brief
Excellent.
blurb.
And you said a professional change. So what were you doing prior to this?
So I've had many careers, but I was working with dogs, as a dog groomer. So
Oh, okay.
yeah, I was looking to go back to school. Nothing medical related, but yeah, I was like, I don't think I want to do this forever. So
Ah, okay. Interesting.
yeah.
That's funny because I was a director of an occupational therapy assistant program, several years ago before I transitioned to graduate education. But I was doing that, and one of my students was a dog trainer, and
Yes.
yeah, so, and she was looking kind of for the same change, but that's
Yeah.
interesting.
It is. I mean, I love dogs, don't get me wrong, but I'm like, oh, I just don't. I want to be with people, someone who can
Yeah.
understand me. Maybe not listen to me when I tell them what to do, but still understand English.
That helps. Yeah,
Yes, yes.
absolutely. Okay.
Yeah.
Well, good. Very nice. Very nice to meet you.
Nice to meet you as well.
Oh, okay. And so the next one I have is Sarah Warren.
Hey, so I am from North Carolina. I'll be moving down to St. Augustine to start that program.
Okay.
And I am currently a CODA. So I'm an
Okay.
OT assistant, and I've been doing that for 4 years, and just kind of want to further my career and just have a few more options within the field. I really love OT, and I keep hearing about emerging practices that are really exciting, and I'm just excited to be back in school. It's been a while.
Yeah. So this will be a change too, right? From being a coded to being an OT. There are some definite, similarities, but it'll be an interesting journey for you. And,
Yeah,
and you'll be able to kind of expand on everything that you already know. So
great.
excellent. Well, good. Nice to meet you. So we do have someone from a different campus than Austin. So good to know. So
Yeah.
excellent. Awesome. Nice to meet you. So, and then we have Sydney.
Hi, I'm Sydney. I'm originally from Pasco, Washington.
Okay.
I am going to the Austin campus, and I chose OT because when I was an undergrad, I wanted to be a hospice nurse, and then I learned really quickly that that's a different breed of people that can handle that. I am not emotionally strong enough for that. I learned that I want to work alongside the patient, not for the patient. I want to see them get better, not get worse. So that's why I
Oh,
chose occupational therapy.
interesting. Okay. Very nice. That's good. And as and as Sarah mentioned, as far as the um uh emerging areas of practice, one of those emerging areas of practice is end of life care as occupational therapists, and helping people to live um, a quality life even as they are entering that next phase and getting ready for hospice care or end of life, and that's something that some occupational therapists specialize in and some are interested in. So interesting. Okay, well, thank you. Nice to meet you, Cindy. um, okay, and then we have Eva. I'm guessing we would say your last name Voigt.
I know it's vote actually.
Vote. Okay, thank you for that correction.
Yes. That's okay. I'm from Paris, Texas originally, and I'm gonna move to the Austin campus. And I originally got into occupational therapy because I went through therapy myself after getting an injury playing soccer. And I just played
Oh,
my whole life and know what it's like to have that ability to be taken away for a short amount of time. And I just want to help others be able to do what they want to do. So, yeah.
excellent. Well, nice. Okay. Well, good. I look forward to seeing you, meeting you in person in January. So that'll be good. Excellent. Thank you. And then we have Ashley Hebert. I'm hoping that's how you say it.
It's a bear.
Hebert. Okay, so you guys know that I'm terrible with names, so I apologize. I do, but Hebert. Okay, thank you.
Hi, I'm Ashley Abear. I'm from New Orleans, Louisiana, and I'm gonna be relocating to Austin, Texas.
Okay.
I chose OT because I've always loved helping people and always wanted to make a positive impact on other people's lives, and I can't wait to make connections with not only my patients but also their families.
Excellent. Good. Nice to meet you, Ashley.
Nice to meet you.
Excellent. Oh goodness. Okay, so I'm hoping this is right. You already know I'm bad at this. So, Aaliyah.
Yeah, it's Aaliyah.
Thank heavens. Oh, good. Excellent. So, Aaliyah, what's your last name?
Campos.
What?
Campos,
Don't.
Campos.
Oh, okay. Nice. Excellent. So, what campus are you
Um,
going to then?
yeah, I'm going to the Austin one.
Excellent. Okay.
Yeah, I got into occupational therapy because I'm a behavioral technician right now, and like I love working with the kids, but also too like I want a broader population, so not just kids focused.
Okay. Excellent. Thank you. Behavioral technicians. I've worked with several of those in my career as an occupational therapist. So excellent. And then last but not least, oh goodness. Okay, so Hannah,
Hi, yeah.
and can you say your last name for me?
It's Van Deventer.
Van Deventer. Okay.
Yeah.
Thank you.
Hi, I'm
Yes.
Hannah. I'm from Port Orange, Florida, and I'm going to the St. Augustine campus.
Okay.
And I also am a behavior tech, and
Okay.
I've worked with kids for many years. And I also had an injury that put me in PT for a while. So with these two things like combined, I just saw how much like is needed, not just on like the behavior side, but also like the physical side. And it made me want to get into OT.
Okay. So it sounds like one of those common threads that kind of unite all of you is that you've had some type of personal experience, whether it was someone close to you or yourself that you have seen the impact, or people that you've worked with that you've seen the impact that occupational therapy can have on people's lives. So that's a very interesting thread, and that's something that unites you guys, right? And can be that force to help make your bond stronger as a cohort. So as you guys are moving forward. So that's excellent. So a couple questions I have, or I was thinking of, that may help to you guys understand a couple of things as you're transitioning into the residential program. And feel free to put questions in the chat. I see that no one has put anything in chat yet, so I guess we're good. But the one thing I want to say, one of the questions that I have is, do you know how to differentiate a lab class at the University of St. Augustine versus just a regular blended class? Yes or no? Anybody can answer that.
Is it the same as like undergrad, like as a lecture versus like a lab class?
Okay. So
I
that's a
guess I'm
good
answering your
question.
question with the question.
I love it. Okay. Yeah, no, that's perfect. So I guess I should back up based off of your question. So this is where I don't know what you guys don't know, right? And until we have this collaboration, this crosstalk. So I guess backing up a little bit, do you guys know what a flipped classroom is? And have you ever learned in a flipped classroom model?
I have not.
Okay. Has anybody on here learned in a flipped classroom? Okay. So this is a good point. A good place to start with and so this is that collaboration like you will be expected to in your classes, right? So I might say something and you guys might say, no, we don't know. So then that means I have to go backwards a little bit and explain a little bit more context. So this is kind of what we do in our lectures or in our labs. So a flipped classroom means that all of the learning as far as the textbook learning, the Blackboard learning, all of the content, you kind of need to go over yourself. And the flipped classroom part is you go over the content, and then when you are in either a synchronous session with your faculty or whether you're in a lab class with your faculty, you are learning how to apply that information, that content that you were supposed to gain prior to coming to lab or the synchronous session. So the comment is usually it feels like we're teaching ourselves, and that's not necessarily the case. It's saying instead of doing lecture and labs and synchronous sessions, we're only focusing on the application of that knowledge that you guys are supposed to read and work on understanding, right? It's not necessarily rote memorization because some of the things aren't rote memorizations. There's some things that you need to memorize, but more of it as a graduate student is for you guys to understand the concepts and the big ideas and the big things that are being addressed, right? And then you come to lab and you learn to apply those and you get clarification on the things that you've read and you can ask questions. Oh, well, I read this. What does this mean in this case or with this population or in this situation, right? And so a flipped classroom, so that means that basically when you're on campus as a residential student, you are doing hands-on learning. You're not going to be sitting and being lectured to like you did in undergraduate. We don't do that at this University of St. Augustine. And that is a shift for a lot of students coming in because they expect to come to class and be lectured to like they did in undergraduate, and that's not how we do it. So we have two different types of classes. We have blended classes, and then we have lab classes. You can tell which classes on your schedule are lab classes because after the number, it might say OCT 5401. And if it has a C at the end of that number, then that means that's a lab class. If there is not a C after the course number, then that means that's a blended class. Okay. So now a good question is, what is a blended class and what does that look like for me as an occupational therapy student? That's a great question. So let me answer that. So a blended class it's not a strictly online classes. We used to in our old curriculum have online classes where pretty much students would teach themselves and they would have very few touch points with professors and they would just learn the material and take tests, quizzes, turn in papers. And that was the sum of it. And they would have little to no contact with their professors besides announcements that were sent out, emails that were sent out, the content that was arranged in the Blackboard. But other than that, there wasn't much contact. And so we wanted to change that with the new curriculum by making sure that we had intentional touch points with our professors each week. And so all of the classes that do not have a C after the number means that's a blended course, meaning that you will have in-person synchronous sessions each week for 1 hour. Each of those classes will have a 1 hour a week synchronous session, except for one class. and that is the conditions class. The conditions class is a blended class, but because it's so many credit hours, it is a 5 credit hour class for a blended class. We are going to have 2 hours of in-person synchronous sessions a week for that course. So, and those classes, those synchronous sessions are not for instructors to come in and to lecture through material. They are for the intention of those classes are to answer students' questions, to collaborate on the material. So if there's something that you guys might not understand or something that you might want to know about or may want the professor to expound on how it's applied to the field of occupational therapy, or what does it mean for you as a future occupational therapy practitioner or as a student, or even on your field work, those are the discussions and conversations that you would be having in those synchronous sessions. The professor may also know that when you're doing a certain unit, there may be some things that they realize are difficult for students to understand and to grasp. And so they will use they'll use the synchronous time to also expound on those things that they know are tougher concepts or tougher topics for students to grasp, and work with you in helping you understand that in a different way. So that's what you can expect as far as a blended class versus a lab class, and what it means to be in a flipped classroom curriculum. Any questions about any of those topics that I just kind of addressed? Okay, so no questions. I will ask the follow-up question to that is anybody nervous about this new format? And if so, why are you nervous?
I would say I'm just nervous in general, but
Fair enough, fair enough.
yeah, just a little nervous, but I think it's interesting. I would be worried, I think, in the sense that like maybe I am learning something and not understanding it correctly and then kind of reinforcing like wrong, understanding. But that's the point of, I guess, coming into class and being like, hey, this has a question mark by it. What is meant by this? How am I supposed to think about this? So I think it's just, for me personally, it would just be like being a little bit more proactive and asking questions and admitting that you need help and like maybe don't understand that topic.
Yeah, absolutely. And so a couple things about that. This form, yes, it is helpful if you do have questions and you are able to go to those labs or those synchronous sessions and say, hey, I have these questions. Sometimes people are more introverted and a little bit nervous about asking questions, but this is where you need to understand it, and this is another of those graduate student expectations, is that you're not here to compete. You're here to learn how to be a professional, and learn a professional skill that you can go out and later help people and either do good things with people's lives or not do good things, right? And hurt people. So if you don't ask those questions, you could be impacting your future clients in a good way or a bad way. So if you do ask, if you don't ask, if you don't ask, it could be a negative consequence, right? Eventually down the road. So, so that's one thing. But the other thing is, that's when, if you are a little bit more introverted like myself, I usually saved a lot of my questions for either the beginning of class or after class if I was a little nervous about asking during class. And sometimes and the other thing you need to learn to utilize as graduate students are office hours, right? So all of our professors have office hours where they're more than happy to meet with students. These are hours that are definitely underutilized by students because they don't feel like professors have time for them, but we really want to see you succeed. And that's why we do have office hours. So I know myself, if I have office hours for students, I'd much rather students come and ask me all the questions and take up all the time than me just sitting there waiting for students, because then it feels like I wasted my time. So take advantage, definitely take advantage of the resources that you have and use the office hours, use the tutors, use the student support services if you need them, right? This is where you really need to take advantage of all the different resources. I know we feel like sometimes people feel like, well, I'm just going to figure it out and do it on my own. You don't have a lot of time to do that. And so the more you can use your resources to your advantage, the better. Okay, this isn't the graduate school and especially occupational therapy programs isn't the time to learn to try to figure it out, because you don't have a whole lot of time to figure it out. You have 3 terms to get all the knowledge that you need as an entry-level occupational therapist. So that's why we've provided lots of resources for you to use so that you can use those. The other thing is about that is it kind of gets you. That's why it's so important to go over your content with the flipped classroom before you go to lab or synchronous sessions, because it's kind of like when you go to field work eventually, whether it's level 1 field work where you're doing observations or whether it's your level 2 field works where you're doing full-time practice as an occupational therapist under the direction of a licensed therapist. But that's when you get practicing doing that being proactive and doing that active learning by going and asking questions in class, gets you ready for field work. Because in field work, I know when I was in field work, I would always carry a pad of paper and a pen, because when I was observing treatments with my therapist, or if I was doing treatments as a student, I would make sure that I wrote down questions. I'd write down patients' diagnoses and look that information up on my own, or I'd go to the therapist and I'd ask them questions like, why did we do this instead of this? Why did they react like this? Or what would be the best way to do this, right? And so by going ahead and learning how to organize your questions and writing down questions and being proactive and asking those questions only helps you and your future clients. Okay, so it is a little bit different. And students are a little bit nervous. And I can say students usually say initially, at least, it feels like we're teaching ourselves. And it may, as far as the content is concerned, but you're really not. We're here to help you and guide you through that. But, and to expound on those things by just working on the hands-on application of those principles, instead of wasting time going through and lecturing about them when you can read them for yourselves, watch your lectures on Blackboard, things like that. So any other question? I'm going to look at the time. Oh, it's right at 7 o'clock. So any other last minute questions? I'll check the chat. It looks like we're good, but any other last minute questions for the last minute or here as you're getting ready to start in a couple weeks? How can I help you? Okay. Sounds like you guys are processing everything that I kind of said. So hopefully that's the case, that you guys are taking in and processing it. Feel free to reach out to me. I'm going to put my email in the chat So you can reach out to me if you have any questions as you're processing everything that we talked about tonight. And I look forward to seeing all of those who are coming to the Austin campus. I'll see you the Friday before Monday, January 12th, and we'll go through orientation then. And yeah, and for those who are going to St. Augustine, I know you'll love Dr. Carey and her faculty there. And so, yeah, I wish you guys well and happy holidays to everybody. I'll stay on a little bit if anybody has any individual questions that you might have that you didn't feel comfortable asking or maybe not relevant for the whole group. But so I'll stay on a couple minutes longer if anybody needs to stay after and ask any individual questions. But yeah, feel free to reach out to me. You have my email. I'm happy to answer any questions that you guys have. But yeah, happy holidays and look forward to starting your journey with you. So have a good rest of your night.
Thank you.
Thank you.
Thanks. Talk to you later.
Sorry, I guess just really quickly,
Yeah.
in your opinion, how likely do you think holding like a part-time job would be with like the workload in the course and also just like the schedule? Like I know it changes kind of like every trimester.
Yeah, so if you've looked at the current tentative schedule, it will depend, it does change from semester to semester. I can say some people do it. Some people do it well, and some people don't do it so well and end up getting overwhelmed really quick and find out that they're not able to work. So it is really individual for each person. Some people who are well organized and who have good reading comprehension are able to read really quick and obtain information really quick in that through that modality could be fairly successful holding a part-time job. But other people who aren't as organized and who have they're not very good at scheduling and they might be procrastinators, usually are not as successful with holding a part-time job. And then I will say, if you looked at the schedule, you can already see how we have it laid out. We have your term 1 on that schedule, and right next to it is term 2. And you can see term 2, because we have so many contact hours for term 2, they're busy pretty much Monday through Friday, almost 8 to 5 every day. There's a couple of spots there, but I mean, essentially they're pretty busy for term 2. And that's the only way that we could have arranged the schedule. So I will say term 2, I could see it being a challenge, but you may be able to do part-time work on maybe a Saturday or a Sunday. And maybe in the evenings for a couple hours or 1 or 2 evenings, but I wouldn't do a whole lot of that. Did that answer your question?
Yeah, it did. Okay, thank you.
Yeah. Any other questions?
Do we have to have like, okay, this might just be a silly question. On the first day of class, like, do we have to bring the books to campus? Because I know some of those are like huge.
You are right. Yes, they are huge. No, you don't have to bring your books to campus. Most of that is you writing, if there's questions that you have or notes that you take while you're reading, you might want to bring those. But yeah, we don't require you necessarily to bring your books to campus.
Okay.
Now, there may be a class or two that may want you to have books, like for instance, the intro to occupational therapy class. It will ask you to buy what we call the occupational therapy practice framework, which is a smaller book. It's a very thin book, but we would ask you you should bring that with you and have it with you at all times, because that's the occupational therapy language that I was talking about, right? So the more you're exposed to it and the more you read it and the more you have it with you, the quicker transition you'll make with the occupational therapy language. So, but yeah, the big books, no, you don't have to bring those and lug those to campus.
Okay,
So
thank you.
that's a great question. Sure. Yeah. Yeah, and let me know if you have any other questions.
Oh, okay. Thank you.
Awesome.
Bye.
Yeah, thanks. Bye.